So hello, everyone. I'm Carla Thorson, Senior Vice President of Programs here at Wildfires. Thank you for joining us today, and today of all days, when our summer heat has arrived and the winds have come around to the north here in the Bay Area, and we've got a red flag warning for fire danger. It seems particularly appropriate that we take a moment and set aside some of the immediate concerns about the pandemic that's ongoing and think about preparedness, climate, wildfires, and health. So I'm delighted to introduce our partner organization, Americares, who worked closely with us to prepare for this conversation. Americares is a health-focused relief and development organization that saves lives and improves health for people affected by poverty or disaster. Each year, Americares reaches more than 90 countries, including the United States, with life-changing health programs, medicine, and medical supplies. In the last several years, Americares has been among those that have responded to California's wildfires, and we're pleased to have today a great group of experts to join us for a discussion about these key issues. So our moderator for the next hour is Bruce Riordan, who is the Program Director for Climate Readiness Institute at UC Berkeley and the Director of the Bay Area Climate Adaptation Network. So Bruce, welcome, and I'll let you take it from here.
Great. Thanks, Carla. Thank you to Americares and to the World Affairs Council for hosting today. And thanks to all of you out in Zoom land here for giving us your time on this critical topic. So in 1 hour, our expert panel is going to shine a big spotlight on climate change and health globally and here in California in the context, as Carla was saying, of our wildfire season, which is starting already, and the context of COVID. So we're going to do this in 3 sections. Section 1, the panel is going to outline some of the key issues, problems that we're facing. Section 2, we'll talk about what to do, about what strategies would be best to get at the health and climate change and wildfire issues, again, in the context of COVID. And then section 3, your questions. So please use the Q&A box that you'll find on your screen. Post questions, and we'll get to at least some of them at the end in section 3. So let's meet the expert panel. First, we have Dr. Riordan, Bernstein, Interim Director for the Center for Climate Health and the Global Environment at Harvard's T.H. Chan School of Public Health. So welcome, Ari. Dr. Linda Rudolph is second, Senior Advisor now to Climate Health and Equity Program at the Public Health Institute. Welcome, Linda. And Kristin Stevens is the Director of Preparedness and Disaster Risk Reduction for Americares. So welcome, Kristin. So we'll start with Dr. Bernstein. Can you start us off here for the hour with kind of briefly outlining this relationship between climate change and health?
Sure can, Bruce, and thank you for letting me participate. I think the day's news, just as has already been mentioned, is making it really clear why climate change matters as much in the middle of this pandemic as ever. I think the first and most important point to make about climate change and health is that you can't really be concerned about any aspect of what provides for human health and well-being and not be concerned about climate change. Whether you're talking about infectious diseases, nutritional concerns, mental health, how our hearts, lungs, kidneys, and the rest of our bodies work. Climate change really gets at, the fundamentals of what can allow for a healthy life. And I think that's one of the most important things to recognize, is that we have everything at stake with our health. And that's particularly true for people whose health we tend to be most concerned about right now, whether that's the children I'm caring for in the hospital today, people who are older, women who are pregnant, and frankly, people, whether it's in the United States or around the world, who have disparate health status. They are less healthy than the population that they live with, often for things beyond their control. That climate change stands to make those disparities worse. And what we're going through right now with the pandemic, I think, is as difficult as it is and as problematic with it is a sign of why climate change is so important to health, because so many of the things we're seeing with this pandemic, whether it is the air pollution affecting rates of people dying and people's long-term exposure to air pollution, right? And those air pollution sources in the United States are overwhelmingly fossil fuels, disproportionately affect people of color and the poor. Whether it's what we know about the effects of heat on people with chronic diseases. So we know that heat is a problem for people with heart disease, diabetes, high blood pressure. Those are the exact medical conditions that are leading to people dying from coronavirus. That we can see very clearly that climate change is really relevant, even when we deal with the seemingly disparate issue of a pandemic. And we're obviously going to hear more about air pollution with wildfires in a minute.
Thank you. That's helpful to get us started. So heat and extreme storms, sea level rise, drought, all having an impact. You're, among other things, a pediatrician. So could you say a bit more about the effects that you're seeing of a changing climate already and what's projected on children and maybe again within the COVID context?
Sure. And I think children are a particularly important group of people to be concerned about when it comes to climate change, if for no other reason than they're going to be living with it longer than anybody. And from everything we know, the effects that we're already seeing today of how climate change matters to health are going to grow in proportion to the extent to which we do something to prevent the greenhouse gases and carbon pollution that's causing the problem. We see already in children the effects of things like higher carbon dioxide levels and warmer temperatures affecting allergy season. We see worse allergies. We see them for longer parts of the year. Allergies are miserable. They cause a lot of discomfort. They're obviously not the worst thing in the world, but they're a very real and clear signal. Heat. So most of the research that's looked at heat has looked at people in the United States over 65, but we increasingly see that heat is a big problem for children, particularly children who have chronic medical problems. Also increasingly clear is the problem that heat poses to women who are pregnant. It can affect their pregnancies. But I think for children, both in the United States and around the world, one of the least appreciated, perhaps most important consequences of climate change on health has to do with the effects of climate change on children's minds. Living through a disaster like a wildfire, living through a hurricane, being forced to move from your home against your will because destroyed or food or water is not stable, and if you don't think that can happen here, think again. That those events, not only do we see evidence already in the literature that increases rates of anxiety and depression in children, but we know that those kinds of traumatic events, called childhood events, can set the stage for toxic stress that can affect the person's health across the lifespan. So we see that children who have greater exposure to toxic stresses in childhood that go unbuffered have much higher rates of severe diseases throughout their life. And so we have a lot more to learn about what climate change means to children's health, but we clearly know that right now, the actions we can take to combat climate change are not only critical to safeguarding our children's future, but they also make the present healthier, whether that's improving air quality because we're not putting air pollution around, whether that's greening cities and cooling them down, reducing the heat effects, that the climate solutions that we have that are affordable and cost effective will really do a huge amount of good towards improving children's health, and especially for the health problems that we have such a hard time dealing with today, things like mental health disorders, obesity. These are affected by access to green space, whether or not you're able to walk or bicycle to school versus sitting in a car, the kinds of foods that are eaten. We know that eating more plant-based diets are much healthier than eating lots of meat. They also, of course, produce less carbon. And so I just see enormous opportunity to really make advances for children's health, particularly again for vulnerable children in this country. We have some 1 in 5 children who are impoverished homes in this country today when we do things that get at climate change.
Great. Thank you. Please, again, put your questions for Dr. Bernstein and the others in the Q&A box. So now we'll turn to Dr. Rudolph. Good afternoon. How does what Dr. Bernstein just laid out in short, but the overall picture kind of globally for climate change and health, how does that align or resonate, Linda, with your work in California, where you've done quite a bit of work, particularly maybe with the fire season starting?
Yeah, thanks for doing this, World Affairs Council and Americares and Bruce. Wildfires have had a huge impact on California and the West, and they're just, as Ari said, one symptom of the magnitude and diversity of health problems that we're starting to see now with climate change. One thing I think people that don't live in California may not appreciate is the extent to which when we get these massive wildfires in this state, we have huge plumes of smoke that affect literally millions of people. And we're not getting these severe wildfires that burn into urban areas where we're not only getting the particulate matter and the nitrogen oxides and the sort of the usual components of wildfire smoke, we're also getting toxic air contaminants as these wildfires start burning buildings and vehicles. And so we're seeing not just the impacts on children, we're seeing adverse birth outcomes, we are seeing increases in heart attacks and strokes related to PM2.5 in wildfires. And we're seeing this incredible loss of homes and businesses and the resultant post-traumatic stress disorder and depression associated with job loss and community loss and home loss that impact whole communities. The one thing I really want to stress is just that in addition to the sort of the individual aspects of increased vulnerability that Ari mentioned, children, elderly, people with cognitive or physical disabilities, we're really seeing disproportional impacts on communities of color and low-income communities. Native Americans across the US live in areas that have very high rate of poverty and a lot of areas at geographic risk for climate change and wildfires. We know that low-income people are less likely to have insurance. They already live in areas that have high air pollution levels, so they have the illnesses that Ari mentioned that make them more prone to the impacts of wildfire smoke or heat. They're less likely to have cars to evacuate from a wildfire. They can't afford to put HEPA air filters in their homes like wealthier people have done after a series of fire smoke events. They may not speak English, so they don't get the alerts that they need. And low-income communities don't often have the resources needed for fire prevention or to do home hardening. The schools may not have modernized air filtration systems in low-income communities. One group that we've seen at particularly high risk in California is undocumented workers, especially those that work outside in agriculture or landscaping or construction, where they're very concerned about missing a day of work. So they'll often work with inadequate respiratory protection right through a bad smoke event. They're not eligible for government services or disaster relief from FEMA or unemployment benefits. And these impacts get magnified in all sorts of ways. In California, we've had a whole series of, we call them PSPS, preventive safety power shutoffs, that are intended to prevent wildfires. But what they often mean is that the lowest income workers are losing wages due to a shutoff, or they're losing a week or a month's worth of food supplies, and they can't because the refrigeration is out for potentially days at a time. So I think it's just really important to remember that even though wildfires, as one example of climate change, impact everyone, they impact these vulnerable people and vulnerable communities disproportionately.
Thank you. Let's put this in the COVID context. I was just reading yesterday, maybe you saw this one, that we've had restrictions on the training of firefighters for the fire season because of the COVID issues this spring, but a number of things. So maybe talk about people that live in high fire areas, the smoke impacts elsewhere, and workers, and how does COVID affect or make that more complex?
Yeah, well, you mentioned that every season CAL FIRE runs these big, quote, fire camps where they train and prepare firefighters for firefighting season, and they had to basically stop doing that because of their concerns about the spread of COVID-19. When we have a really big fire in California, the CAL FIRE base camps may have, thousands and thousands of people, and these fires last for weeks, and they're bringing in firefighters and law enforcement people and paramedics from many other states and from all over California. And so there's a huge question about how will we feed and house thousands of people at these base camps and still maintain social distancing? And what are the implications, especially if we bring people from an area with a high COVID rate to an area with a lower rate? What does that mean for those communities? And what kind of changes can be made within firefighting units to prevent the spread of COVID? Although we are very concerned about wildfires now in June, our worst wildfires in California typically happen during the very late summer and they're in the fall. And that's potentially the time of this quote, second wave of COVID. And it also raises huge questions about how will we house displaced and evacuated families when we're worried about maintaining social distancing? How will we make sure that everyone in those shelters has not only clean air, which we've had a problem with in the past, but also masks to prevent COVID and hand washing and hand sanitizer and so on. And of course, people have no doubt seen in the news that people that are exposed to particulate matter fare worse when they have COVID. So what are the implications of having these very dispersed, widespread wildfire smoke events at the same time that we're having people that are being exposed to COVID? And finally, the last thing I want to say about this is that COVID's had a huge impact on state and local government budgets. We have a $54 billion deficit in California. And one of the programs that's on the cutting board because of that deficit is programs to do home hardening, for example, installing fire-resistant roofing in low-income homes. And that's really a tragic effect of the budget impacts of COVID.
Thank you, Linda. And questions for Linda, again, in the Q&A box, and we'll get to some of them at the end. So Kristin Stevens from Americares, what are the impacts of a changing climate here in California and beyond mean really for health clinics and systems in the front line? Talk to us a little about that. You're still muted.
Sorry about that.
There you go.
So in thinking back on past work in health center preparedness, health center resilience, I found some recent notes, a project I did about 5 years ago, and we were talking about potential impact at the community health center in disasters. And one of the things that was overwhelmingly reflected in the group was we don't do disasters, right? Like, we're community hospitals do disasters, community health centers don't do disasters. And if there's a disaster, we'll just close. And now thinking 5 years later, how much things have changed. COVID, climate change, and looking at what the health centers in California have gone through with wildfires, saying that disasters are off the table for community health centers is no longer an option. And it's been a real challenge for people because, some of them have reflected to us that they didn't sign up to do emergency medicine, right? They do community health, they do primary care, they do diabetes and hypertension, they do physicals. They didn't sign up to work in this disaster environment. And so it's been a real challenge for them trying to figure out how to manage that with the other critical work that they do. And then also, as both Ari and Linda talked about, the vulnerable people who are more vulnerable before disasters are even more vulnerable after. Well, that's also the target population of who they work with. So health centers themselves, they tend to be under-resourced. They've typically been left out of community-wide emergency planning because the focus tends to go to acute care hospitals. They're serving the most vulnerable people who are going to be in worse situation after. So it's been a challenging few years for community health centers. It's really changed the way they think about climate change and preparedness and disasters overall.
Say a little more about the effect on staff at these community health centers. Wildfires and heat and floods and COVID now, all of it. What's the impact on the frontline workers themselves?
They are feeling the stress. They are really feeling the stress. They carry a double burden because they often live and work in the same communities. So they might be victims of the same disasters that they're responding to, right? Their families, their homes might be in danger, and they're still going to work to take care of other people while trying to care for their own patients. They're working in considerably more stressful environments than they've worked in before. And in a lot of these health centers, the environments to begin with, and now they're dealing with all of these compounded factors that's increasing the stress on them, and they are working longer hours, they're working different hours, they're working in changing environments. They're having to get new health information, new health guidance. One of the big things that we've worked on at Americares with our COVID work is making sure that health centers know where to get the most current information to stay on top of COVID. Things have settled down a little bit now, but even a couple months ago, there was changing guidance. Sometimes you'd have to go to the CDC every day and say, okay, where are we today on this, in this unfamiliar changing environment? And that's not an environment that they've been used to working in. And then they have not typically been tapped into the larger systems within their community, that larger emergency management system. So they were already starting behind, which is also increasing the stress.
Thank you, Kristin. Again, questions for any of our three panelists in the Q&A box. We're going to turn now, section 2, to what are the best strategies to deal with the issues that you've laid out? What are we doing, and what do we need to be doing going forward? And we'll start with Linda. You've worked for many years, I know, at the state and federal and global levels on climate change and health. What are the very most important policies or programs that we should be either expanding or putting in place? You're on mute.
Sorry about that. Thanks. That's obviously a complicated question. There's lots of different answers. With respect to wildfires, I think there's some things that we should be thinking about sort of in the near term, like, figuring out how to do better monitoring for smoke and better smoke alerts, how to make sure that everybody has access to a clean air shelter if they can't create a clean airspace in their house, how to make sure people have safe evacuation routes. All the things that we've learned haven't worked very well. What can we do to make sure that every community has a few places that are easily accessible that have clean air and heat protection, air conditioning? How do we make sure that we're identifying vulnerable individuals and making sure that they're adequately protected during a wildfire or a heat event, or a flood for that matter? We need much better protections for wildland firefighters and outdoor workers than we have seen to date. We need to better prepare our hospitals. California has seen some truly horrific, mid-wildfire evacuations of hospitals and skilled nursing facilities. And then, of course, we need sort of longer term wildfire specific actions like better forest management, better land use so that we're not building more and more buildings in the wildland urban interface or the WUI, as they call it. But as Ari pointed out, it's not just wildfires. We're seeing this confluence of wildfires with drought and floods and biodiversity loss and heat and ecosystem degradation. And so we're really seeing that the climate crisis is a global health emergency. And as it gets warmer, the health crisis of climate change will only get worse. And we can only avert, catastrophic impacts on human health if we address our greenhouse gas emissions and reduce them as rapidly and as much as possible. So from a policy perspective, I would say that the first order of business is to implement the transformative policies that we need for a rapid and just transition to a zero carbon economy. And that means rethinking the way we move around, the way we grow our food and what we eat, the way we heat, cool, and light our buildings, the way we think about land use, and the way we treat ecosystems and our natural resources. I'd encourage everybody to look at a climate, health, and equity policy action agenda at climatehealthaction.org, which is a policy action agenda that's been endorsed by over 150 of the leading medical and health organizations in the country. And that agenda really speaks to, more specifically, the need for, first of all, the need for placing equity at the center of climate policy so that we address these very stark and persistent health and social inequities that are driving chronic disease and disproportionate health impacts of climate on health. We need to, really establish very ambitious targets and timelines for renewable energy and energy efficiency, and make sure that people in low-income communities have access to clean energy and affordable energy efficiency. We need to, align our transportation spending with our climate and health goals, for example, by increasing funding for public transit, increasing funding for bike, walk, and infrastructure, focusing less on building new roads and on fixing the road and infrastructure we have. Our agriculture system currently subsidizes commodity crops and livestock that are climate unfriendly agriculture. We need to shift our incentives in agriculture to focus on producing affordable and accessible healthy foods. Ari mentioned the importance of greening our communities through green infrastructure and expansion of tree canopy. And then, as has become much more evident with COVID, we need to rebuild a very frayed public health infrastructure so that we have the capacity not just to address urgent health crises like COVID or the next pandemic, but also so that we can address the impacts of climate on health moving forward. And that's going to require really that we more fully inform the public and policymakers about the links between climate, health, and equity.
Thanks. That was climatehealthaction.org, right? The
Yes.
URL. Yeah, good. Okay. Ari, let's focus again on climate change and children for a few minutes. What are the most important strategies you think and actions to protect children? I mean, we have a hotter and it's not just a changing climate, an unstable climate at this point. Looking ahead, what do you think in terms of specific strategies around children?
Yeah, well, I don't think I could have said it any better than Linda. I mean, she just gave you, I hope you're all listening, because that was about a succinct and comprehensive overview of what we need to do as humanly possible. I think that in the realm of the aspirational, I would say we would do well to listen to our children. I've been a pediatrician long enough to realize that, children don't get, we talk about children. We talk a lot about what they need. I'm not sure we actually have listened very closely, and I think that was most apparent with the protests of last year, where we had millions of children in this country essentially telling us we're ruining their future. And if you really take that to heart, if you really think about what that means, it would drastically change how we were thinking about this problem. Economists hem and haw about whether it makes sense to invest in the kinds of solutions that Linda was talking about, how much we should be putting into renewables. And by the way, there's very good news on that front. It looks like this year is going to be the first year in human history where more money is spent on renewable deployment than on fossil fuel exploration. If that happens, that's a big deal. And to that end, the trajectory of renewable investment globally would put us on a pace to keep us within 2 degrees Celsius. I think that, if we listen to those children who are protesting the streets, who are striking from school, and recognized that what they're asking us to do is not just make their present day circumstances much better, but to afford them the kind of world that we grew up with, that they deserve. And that is amplified by, orders of magnitude for the children who've been given, the least fighting chance of leading a good life in the United States and around the world. And so I just, at the end of the day, you look at what people really value, and we see time and again that people really view climate change as a very different concern when it's understood as a concern about what we're delivering for our children's future.
Thank you. Switch gears a little bit. Kristin, how is Americares working with local health clinics and community clinics to build resilience to climate change and protect vulnerable populations? Talk to us a little about that.
Sure. So we have ongoing.
Hold on, there's a mic problem. I think it's better. Try it again.
Is that better?
That's much better. Don't move.
I won't move. So we have ongoing preparedness work around the country and in a couple countries around the world as well. And we focus on what is called an all hazards approach, which teaches health centers how to respond to a variety of different emergencies, giving them the building blocks of an effective response. When we look at it in terms of climate change, there is actually a considerable amount of overlap between what you can do around climate change and what you do for sort of regular disasters. But one of the things that we're really looking at is how to bolster this. And how to
Kristin, your mic again did something. You're a little muffled.
I'm not sure what's going on.
Yeah, that's
the
good
window.
there.
All right, I'll get closer to the window.
Yeah.
Sorry, it's tough in New York City these days. One of the things that we found is that there's significant overlap between recommendations around climate adaptation and standard guidelines around disaster preparedness. But we think that more can be done on that front, and we believe that more can be done to help health centers, and we are currently exploring several options for that. Right now, though, the whole world is focused on COVID. As my friend Ari Bernstein says, though, climate solutions are pandemic solutions. So we know that the work that we are doing around pandemics is also going to inform future work around climate solutions. So we're trying to walk that line between meeting people where they are, what the immediate needs are in front of them, and at the same time towards building a more holistic, resilient future and process. We also have, so we have extensive preparedness work. We've had work already in place in California. We also have an extensive mental health, COVID mental health menu that also informs a lot of the same work, looking at grief and coping and stress and managing emotions, psychological first aid. So all of that is going to be underway in California too. And then finally, we've had a very generous donor has supported a project that will allow us to help integrate the work around preparedness and mental health. So I talked about some of the stressors on healthcare providers. we all know how difficult it is when you're very stressed, when you're feeling very pressured. You tend to forget things, you tend to miss things, you tend to make mistakes, right? We all do that. And then now imagine being a healthcare provider and feeling all of that and trying to make effective decisions and care for others. So we're looking at ways that we can incorporate that mental health work into supporting the best possible health outcomes for patients, but also for the providers, because we're concerned about the long-term health and well-being of those providers.
Thanks. Okay, let's open it up to questions. So if you have a question, please put it in the Q&A box, and we'll get to some of them now in this third part. And I'll start with first one that came in. Right now, we're trying to deal with COVID. We're trying to deal with extreme weather and climate change and civil disruption and political, shall we say, turmoil. So the question this person has raised is, in the public health world, how do we deal with, or what's different about dealing with multiple stressors like that at once? For any of you.
Well, I think one thing is clear is that each of those challenges that the question laid out, whether it's climate change, the pandemic, racial inequality, to me, the common denominator is the inequality piece, because whether you're talking about COVID or climate or the other stressors that come into play, these all course through the fissures in society that inequality creates. We've seen it in spades with COVID. The people getting infected, the people dying are those who are poorest people of color. So too with climate change. And so, we have to take much more seriously the reality that inequality persists, and that it is not just a morally inexcusable stance for a country, particularly as ours, that's as rich as ours, and that it is enormously destructive to the welfare of the individuals, families, and communities that are in this position. But it is a direct threat to all of us, that no matter how rich you are, how privileged you are, these inequalities reach into all of our lives. And so it's incumbent on all of us to work towards fixing them, because we will never be able to fix climate change, for instance, without combating racism and vice versa. So as one example.
Linda, Kristin?
Well, I would hardly second what Ari just said, but I think the other aspect is that many of the problems that we're seeing have common root causes: that inequity, the inequality, climate change. Some aspects of pandemic, have similar root causes. They're driven by structural aspects of our society that favor profit over people. They're driven by belief that we can exploit nature and exploit people without ill effect on ourselves. I think Ari knows quite a bit more than I do about how deforestation drives not only climate change, but also drives the emergence of new infectious diseases and pandemics. And so, my perspective is that we cannot address any of these issues without looking at these fundamental structural issues about how we relate to each other as people, and how we relate to nature. And that does require the kind of transformational systems change that I was speaking about earlier.
Thanks. Kristin, same question. Americares, community health clinics, multiple stressors, different way of doing business, or?
So it's, the same way vulnerable people are more vulnerable after disaster, resilient communities do better after. Americares works with a partner network of 4,000 centers around the world These health centers are very much embedded in their communities. They have strong partnerships with local organizations. We've done trainings for health centers, and they say, well, can we bring our partners? And we'll say, sure. And we see, food banks showing up, right? We see people from homeless shelters showing up. We see, these are their partners, these are their networks. And so we know the power of partnership, and we know that when you have those relationships in place, any one of us who has ever been in any sort of crisis in our own life know the value of having somebody to call, right? And the same thing is true of organizations and communities. And, you need to have that infrastructure in place. So this all speaks to the issues of equity and inequality. And, if a community is suffering day to day, they have fewer resources to draw from. They have fewer people to call. They have fewer people to ask for help from and stuff. So if we can build that up stronger, then in emergency management we talk about that as mitigating some of the risk. What can we do to just take some of the risk off the table? And as a bonus, we're building stronger, healthier communities.
Good, thanks. Okay, this next one from the Q&A box, and folks, please put your questions there, is a practical one about COVID and climate, and it's about masks. So Linda, maybe we start with you. We've had conflicting guidance here in California when we've had big smoke events about wearing masks. We even had conflicting guidance at the beginning of the COVID emergency about masks. But what's the advice now? What's the thinking about masks with COVID and with smoke?
That's a great question. And I actually don't know what other people are thinking, but I think there's pretty clear evidence that wearing cloth coverings does not protect against PM 2.5 and the fine particulate matter that we're so concerned about in wildfire smoke. So the best way to protect against wildfire smoke, N95s are useful. They do protect against PM 2.5, and they're not available. One could ask why it is that in our nation at this time, the wealthiest nation in the world, we're months and months into this and we don't have an adequate supply of N95s for healthcare workers, let alone for wildland firefighters or the people that are exposed to these wildfire smoke events. And I think we could use some real political pressure to change that. But we need access to cleaner air shelters and cleaner air spaces in homes and in community centers. And I already talked about the challenge of that when we're trying to do social distancing. People can create a cleaner air space at home by using a portable air cleaner in one or more rooms. It's recommended that those be run with the doors and windows closed. Some local health departments in California have actually been recommended, but they're expensive, and people that are living on a fixed income or low income individuals may not be able to afford a portable air cleaner. Some health departments in California have recommended these do-it-yourself box fan filters. I don't think that those have been adequately tested, but they may be better than nothing. And of course, another problem with do-it-yourself home clean air shelters is that many people either can't afford to keep their air conditioning running or they don't have air conditioning. So when you try to keep a room closed with the windows closed and you have heat and smoke, you really have a bad combination. People that do have air conditioners can turn the external air off and at least get some respite. But it's a really challenging issue and one that needs a lot more attention, starting with making N95s broadly available.
Good. Let's combine. I've got a couple questions I'll combine. People are asking, as always, with climate and all, what can I do? So combined with a couple of the other questions here, What can an individual do that's here today with us on the webinar? What can foundations do? We know we have some foundations in attendance. What can people do as collectively more about policy and all? So who'd like to start on that one? What are some things, some specific things that individuals, groups, foundations, and others could do?
Well, at Americares, we function based on partnerships, and partnerships with health centers, partnerships with foundations, partnerships with other nonprofits. So we are always looking for opportunities to continue to advance that work. We know that a lot of great work is being done in many different areas, and so we're always looking to leverage our expertise with other organizations' expertise. People have in-house knowledge, they have their own networks. There's, a real push to try, in emergency management, we always say that in a crisis, it's difficult to get big enough fast enough. And that's how I feel about the climate crisis. And I feel like the way that we can get big enough, probably not fast enough, but get bigger and get faster is by forming partnerships, is by leveraging networks, is by leveraging knowledge. So I feel like there's tremendous opportunity out there to advance that work together.
Thanks. Ari, what would you add to that?
I'll put a point on the statement Kristin just made, which is one of the partnerships I'm most excited about is the partnership we're forming at our center at Harvard with Americares. So to any foundation out there that wants to support something that really gets at improving the resiliency of healthcare on the front lines of this country, we can talk, because we recognize jointly that we can do a lot together by bridging the expertise we have at Harvard and public health and what we know about climate change and its health effects and what climate models tell us about where risks are emerging, and the extraordinary track record of Americares with engaging with frontline health centers and working on disaster preparedness, though not always with the ability to do so with the climate lens. To the other question, Bruce, which is individuals, that one's easy. We need to vote. We need to understand that politicians in this country often have very strong stances about what is needed as relates to threats like climate change, and they're on the record. And to accept people in federal office or state office in this country who would deny the existence of climate change would be bad enough. But to suggest that we can wait and that we shouldn't be pushing incentives and policies that would spur and accelerate the changes we need is simply inexcusable. And I feel bad enough for their own welfare, for their own reputations as history unfolds. But I'm more concerned about the welfare of everybody else who were beholden to politicians who either willfully or out of ignorance are not acting in our interests on this issue. And the truth is that many of the folks who have the most at stake on this issue don't vote enough. And so we absolutely need to be voting on this issue.
Great, thanks. Linda, what would you add to that?
Voting is really important. Every person can go and talk to their electeds and candidates that are running for office about why climate change is an issue of human survival, and that it is the biggest issue facing our children in terms of their health and well-being into the future, and make that point and let them know that, I vote on climate and health and equity. I think that goes for electeds and candidates at the local level, at the regional level, at the state level, and at the national level, because we can take action in every one of those locations. I think it's really important to talk about climate change and health to everyone that we know, because many people aren't fully aware that climate change is our greatest health challenge. Even in light of pandemic, it is the greatest health challenge of this century. And I think that we really need more people to actively support the kinds of transformational changes and and support, new kinds of approaches to transportation, energy, and agriculture where they live and where they work.
Thanks. Next question. Can you discuss the ways that future disaster response may be impacted by a potential decrease in volunteerism due to COVID? So this isn't kind of an immediate issue we're seeing. Understanding that many of the activities rely on volunteers for some of the things we're talking about. How do you think we deal with that in terms of the COVID pandemic now and in the fall?
That's a huge challenge for Americares, as a big part of our emergency response is deploying teams of people to support emergency response. When it's a disaster that we have some lead time on, like a hurricane, we'll often embed people in the area in advance of the storm so that they don't get locked out. And COVID changes all of that. So as someone described it, we're going back to our roots, which is focusing more on the local partnerships and the local resources. We do a tremendous amount of provision of donated medical goods, and so looking at working with those partners that we already work with, but shifting a little bit of how we would do that work and focusing more at the local level. But it's a big issue for Americares, and it's a big issue for health organizations around the world. Of if people can't travel, or if people, are you going from a hot zone, into a place where you don't want to be the one bringing disease in, right? You don't want to be the one picking something up and bringing it back. So it's going to change a lot, and I think that it could have severe negative consequences for people who are being hit by these disasters. It's a very frightening prospect.
Sure. Here's the next one from the Q&A box. What's something that you or your organization has learned and experienced from COVID and from this emergency that we can use for the climate emergency that we're in the midst of?
I think we've learned a lot from COVID, or I'm hoping that there's been some lessons. One, we've learned that expertise matters and science matters, and that when the world's scientists and health experts are telling us that we have a climate health crisis, we should actually pay attention. Mm-hmm. We've learned, once again, not a new lesson, that prevention matters and that early action matters. And we have opportunities now to take action on climate change before we have even more catastrophic changes. We've learned that having a robust, well-funded public health infrastructure matters, and that will matter with climate change and pandemic and many other kinds of disasters. I'll stop there.
Well, Ari, what do you think? What have we learned from COVID that will be helpful for the climate work ahead?
Yeah, I would really underscore what Linda said. You imagine a scenario in where a bunch of scientists get together and they use research to develop models that suggest what's going to happen in the future, and that people actually act based upon those models and prevent huge numbers of deaths, right? So that's exactly what happened with COVID. Mm-hmm. Because we've been, I think it's a critical point that Linda made, which is the fact that in this country, I get to work, for instance, with people who spent their careers understanding how epidemics emerge and spread through human populations, through studying influenza and other diseases. Those are federal taxpayer dollars that have been invested in people's careers that have saved, in this one epidemic in the United States, probably hundreds of thousands of lives. That the early models that showed, you remember the days where we were talking about a mortality that was going to be, many-fold more than we've seen. And in light of that, people got on board with physical distancing. We use science to say, we didn't get it right on masks, and we've learned that masks help. Well, to Linda's point, we've done the same thing with climate change. We haven't invested nearly enough in the scientific community, but we've invested enough so that same research that has used data to design models that are showing us what's coming, the order of magnitude difference, COVID looks like, I'm sorry to say, a blip on the radar. And so the good news is that when crisis happened in this country, when this pandemic hit, we saw people loosening their grip on crackpots who were saying, use certain drugs because they're going to save your life. I've got this great, someone saying drink, detergents, whatever it was. And they turned to people who knew something. And that is really, to me, a very important message, because we could have turned to alchemy. We could have turned to witchcraft, but we didn't. And so one of the things that I think comes out of this is that when it comes to climate change, we have to make it much more personal. We can't expect people to push COVID and the economic crisis out of the front burner for the sake of 100, even as concerning as it is. We have to make it clear that the actions that we take today about climate change are going to make us safer from COVID. They're going to help our economy be more resilient and robust. They're going to deal with the equity problems that drive things like coronavirus through our communities and cause such devastation. And if we can do that and use the credible voices that we have, I think we can do a lot more, a lot faster. And I think that that is perhaps one of the most important things that has come out of this otherwise disastrous experience.
No, thank you. Kristin, same question for you or Americares, lessons from COVID that we can take to climate in the future.
Yeah. So, going back to what I was saying about getting big enough, fast enough, one of the things that I've been amazed at is how quickly communities and states and the country and other countries in the world could rally to do something. And when you think about all of these industries where they're like, oh, this could never be a remote work situation, right? Like all of a sudden, entire call centers in India are suddenly working from home, right? Entire banks are working from home. All of these things where people were feeling like we can't, this is too disruptive. We can't make massive change. And yet when we had to, people did it. And so to me, it shows that there is real potential for collective will if we can harness it and drive it effectively. And to me, I feel inspired by it. And figuring out what do we do with that now that we know all of these things that people said were impossible are a little bit more possible because now we've done it. So I think that's one of the big lessons. And then the other lesson is, it's difficult even in light of no matter the size of the disaster in the news, the size of the disaster in a community, it can be difficult to get people to prepare for emergencies. And one of the biggest pushbacks we would get is, well, we don't have disasters here. That doesn't happen here. And so whenever we would do a tabletop exercise, we always used a pandemic situation because we're like, nobody's immune from that. And now we're actually in that situation. And so, I'm hopeful that that's going to show people that it does affect everybody and that there is value in preparation. And, has everything gone perfectly in COVID around the country? Absolutely not. But 15 years ago, I was an emergency manager for the New York City Department of Health and Mental Hygiene. And I have seen things going on in this city that were parts of planning that I worked on years ago. And I could see it just from the photos in the news, and I knew exactly what stage of the plan they were at because planning works and preparedness works, and it's a worthwhile investment. So I feel like that's a positive, and I'm hoping that we can leverage that moving forward.
Great, and we'll close on that positive. Thank you, Kristin. Thank you, Linda. Thank you, Ari. Tremendous panel and tremendous hour, and I will turn it back to Carla and the World Affairs Council now. Carla?
Thank you.
Thank you so much, Bruce. And thank you to our panelists, Kristin Stevens from Americares, Linda Rudolph from the Public Health Institute, and Ari Bernstein from the Harvard School of Public Health. This has really been a fascinating and really important conversation, and I'm glad we were in a position to host it today. You can learn more if you haven't learned enough yet. First of all, Bruce Riordan has authored a great paper on health, wildfires, climate change in California that's published by UC Berkeley. You can visit Americares.org on the web. You can visit climatehealthconnect.org or the Harvard School of Public Health, which is hsph.harvard.edu/c-change. And lastly, let me just say that if you value what World Affairs does, please consider making a donation to World Affairs to help us continue to be able to do this work. And you can also join our regular webinars, which we have been doing once or twice a week since the pandemic started, and which we plan to continue to do. And most importantly, there's a project of World Affairs, the Global Philanthropy Forum, which we host every year. And it's a gathering for philanthropists to think about ways to work together and better leverage their giving. And this year, the Global Philanthropy Forum is focused on climate change. And it will be held in September. And we've just announced that it will be a virtual event open to many more folks as a result of it being done virtually. And it is called Facing the Future, a Changing Climate in a Changing World, September 14 to 26. So if you're, 14 to 16, not that many days. But please consider learning more about it. And we're really delighted to be able to take up this conversation and keep building on the knowledge and all the thoughtful people who are involved. So thank you all so much for joining, and take good care, stay cool, stay well.
Thanks, everyone.
Thank you.